I'm not going to thank again the organizers, etc., etc. I will just start. The idea is to focus on an initiative and not to tell you the experience in Argentina about everything that is related to the process and patents, but to focus on a joint initiative that the Ministry of Health and Innovation have been working, because policies align themselves. Our country is a country where right to health is a constitutional right. The right to have access to medicines is one of the main therapeutical tools that physicians have to prevent diseases and cure people. On the other hand, the pharmaceutical industry provides jobs, innovation, income to the country, I mean the national pharmaceuticals located here. And considering all this, we ask ourselves, what was there in Argentina? What is it that we were giving patents to? We found a situation where we have monopolies in the market that exercise their power perfectly. They set prices way above others. And we asked ourselves, why do we have these monopolies? What should they do? So the first thing we wonder is, what is patentable? The article is very clear: processes or products that involve an invention and are susceptible to industrial application. The Argentine law that is adapted to TRIPS says, well, it is patentable, all inventions of products and procedures, as long as they are new, have an inventive activity, and are susceptible to industrial application. This is what it says, and this is what we as a country should enforce. So let's characterize the patents we have in Argentina. What is it that we have? What kind of pharmaceutical monopolies are we talking about? So there was a study conducted by Professor Correa, and the study analyzed the types of patents.
De las patentes que logramos identificar y analizar apropiadamente.
So these are not all of them, but these are many of the ones we could characterize that are due in the next years, many of them, 5% in 2017. So we see that most of the pharmaceutical patents are not in national hands. 43% the European Union, 36% the US, Switzerland, and only 2% are held by national companies. So again, a new question. Is it true that intellectual property incentivates innovation and R&D in our country? And if we see this, we should see that no, it doesn't. It may incentivize innovation in other countries, but not here. When you check nationality and the number of laboratories, the number of pharmaceutical companies, this is 2001, 2007, 50% of the patents granted were in the 5.5% of pharmaceutical companies. That is, 5.5% of the pharmaceutical companies held 50% of the patents. We also may say that 10% of the patents, no, 10% of the pharmaceutical companies concentrated 62% of patents. So concentration was really important. These are patents which holders are not national companies. So how much do these incentivize R&D? This tells us that not a lot. We also wanted to see the distribution, and what we see is that concentration is high. Few pharmaceutical companies take a big portion of everything. So we should think why. A very important step was to characterize these companies and these patents, and we saw compositions, salts, therapeutical indication, or we found some things that were not liable of patent and that were not that couldn't be granted a patent in Argentina. So probably 70% belong to these groups of salts, polymorphisomers, a mix of isomers, etc. So if the patent an incentive, does it really represent a theoretical criteria to recover the investment to create innovation? Does this respond to innovation? Are patents really aimed at this, or are they just an excuse to guarantee the monopoly power and the income that these monopolies get? Based on this, we review the guidelines, the experts' recommendations, and many say that 70% of the patents we characterize as salts, polymorphs, etc., do not have any problem with invention. When we face this situation, we think, what can we do to mitigate the impact of these legal monopolies that exist thanks to the intervention of the state? So even the most conservative should remember that patents exist because the state intervenes and protects them. So the state should review the standards. There are different moments when you can mitigate monopoly, the power of monopolies. We should look for methods of research and development that do not end up in a monopoly. The previous panel discussed this. The WHO was focusing on diseases type 2 and 3. But for developing countries, alternative mechanisms were the thing we should be working for: joint projects, coordination, funding pools, many initiatives that will end up disassociating the price of a medicine from R&D costs, de-link the price from the R&D cost. Many times I wonder that the linkage is important. I do think so, but R&D should be linked from medicine price. I think it is already linked. Herman showed this. How much does it cost to do research and development? How much does it cost to develop a new molecule? 2 billion or 100 million, as the last study that they showed? If we cannot know how much R&D costs, it's very difficult to associate or link the price. So, and we know that the price of a medicine in different markets is different. So, is R&D really linked to the price of a medicine? When pharmaceutical companies price their products, do they really focus on recovering the cost of R&D? No, I think they just try to get as much as they can to maximize their benefits, not to recover costs, just to take as much advantage as possible from monopoly power. Now, if prices are linked to R&D, it would be it, it would make sense to continue talking about the linkage, but the linkage should really refer to remove this excuse. R&D cost has nothing to do with price, so let's talk about price. Let's remove R&D costs from the table because it has nothing to do, because we don't even know how much that cost is. How much did pharmaceuticals invest in taxosumab? And they sell 6,000 billion. Even if the cost of R&D was very high, in 1 year they got their return. So that debate is worthless, but I believe we have to continue working on changing the system. We should consider a different system. The state has a big role to play. The global commitment is important, and I believe we are working in this field. And this new treaty should be a pillar for our positions. Then, during the application process, we have to comply with certain international commitments, but we should consider what has an industrial application. After something is protected, we have to consider flexibility in trips and prior agreements, which is granted before. I mixed up the lines when I was reading it. I was reading the slide. Centralize procurement processes that can relate to the OPS rotatory process. So we should have a bilateral monopoly that mitigates the monopoly of the supply. But as somebody asked today, this fund could not negotiate the vaccine for the virus of human papilloma. Many have suffered this, but not many have found a way to guarantee the continuance of these vaccination programs. And finally, before we grant the protection, you know that marketing expenses are very high, and they spend this money to continue being a monopoly. So even when I have the patent, when I have my margin, I will try to keep my monopoly, and the state should foster competition with generics. Some things relate to health regulations, and we support these similar biotherapeutical products, which is again an excuse when they could not foster patent. Now they refer to the need of highest standards for sanitary records. So requirements are made it impossible to have more products. And this relates to the WHO resolutions where they said that records should not be a barrier to universal access to medicines. We have to have safety, security, and efficacy, but also access. Now let's go back to B. What can we do during the application? We said, can we interpret these three criteria? And we said yes. TRIPS said in Article 7 that protection of servants should contribute to technological innovation and to the transfer and dissemination of technology. And Article 8 says that states can adopt any necessary measure to protect public health and nutrition and to foster public interest in sectors of vital relevance for the social, economic, and technological development, and they can also apply proper measures to prevent the abuse of intellectual property rights. So we can do what I was saying. The Doha Declaration says that no country should adopt measures, no country should prevent the adoption of measures to protect the health and life of people. We found that we can interpret things ourselves when the agreements were signed, especially in the Doha Declaration. The idea was that countries could adopt their own measures within the framework of the agreement. This is an inspiring step.
Pasó previamente por una instancia de negociación en Mercosur.
This relates to Mercosur reality. This morning, Dr. Sell recommended what we could do. Well, this is one of the things, and this is the path we are following in Argentina. But first we had the minister meeting of the Mercosur ministers meeting that considered that in our region there is concern because there is a proliferation of applications to be granted patents on materials that are not an invention. So the ministers agreed to foster the adoption of criteria that would allow our ministries and institutes of innovation, technology, and health to implement instructions, to implement guidelines, not to interpret. Now I'm going to go into a detail. But these are instructions for evaluating committees that are available to those who want to know what are the criteria to be applied. This makes the process transparent. These are general instructions. Some exceptions can exist, and if any, they should be properly supported. This is very important. These guidelines do not add any new criteria. They just interpret the criteria agreed in TRIPS. This is not a new criterion. They just are an interpretation that make or present our interpretation of the TRIPS agreements. These are the items. The joint resolution will be in your folders. Recommendations on polymorph, pseudopolymorph, salts, esters, metabolites. You can see the list. You can review this. When this started, something was triggered, and if we check the average number of patents, we are granting less patents. Many people are not happy. and they are discussing constitutionality, legality, or even a comma in a paragraph. We hope that things will be, that judgments will be in our favor, and we invite you to continue working like this in the region. I remember that the Medicine Action Group in the South American Council, an item was to move forward with the patentability guidelines. Same in Mercosur. Mercosur is now discussing in the industry group, group number 7, that is binding, that should be included in the legal framework of every country. So this is not just a political declaration, but a binding declaration. And UNASUR, I've been talking to many people. I discussed the case of Ecuador. They are working on the definition of these items. We share our experience and we make it available for all of you. Thank you very much.